Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Monica Minjeur, who is the founder and CEO of Radiant Clinic in Cedar Rapids, Iowa. The mission of Radiant Clinic is to restore natural menstrual cycles to improve health and promote fertility. As a board certified family medical physician, Dr. Minjeur specializes in testing and treatment for irregular or painful periods, PCOS, recurrent miscarriages, infertility, PMS, and other gynecological conditions. She's passionate about providing education for using fertility awareness methods to get to the root cause of menstrual related concerns and improve the health of the women she serves. Dr. Minjeur also hosts the podcast Cycle Wisdom, where she talks about menstrual cycle awareness and natural ways to restore fertility. It's a little bit of a tongue twister in all that menstrual cycle stuff, but a very important topic for my audience. So, welcome to the show today, Dr. Minjeur.
Thank you so much for having me. I'm excited to talk with you and with your listeners.
I wanted to have you on the show for a variety of reasons. Firstly, you've recently opened your clinic. Well, maybe not so recently, almost a year probably at this point, in Cedar Rapids locally. And we want to support other local small businesses, especially female owned businesses. But secondly, previously, you were working as a primary care provider, and you were my and my son's primary care providers, and many of my patients who all miss you, some of whom still see you. But part of you being my primary care provider was that you got to follow me and help me through my infertility journeys. And many of my listeners have heard kind of my first part of my first story. And now I have a second story, right? Being finally pregnant again. But I am someone who did use, and you can kind of correct my terminology here, but I use the Creighton method, kind of fertility awareness and charting, which we're going to talk about today. I ended up taking HCG and progesterone injections. I'm still on progesterone injections with this pregnancy, as you know. I had multiple laparoscopies for endometriosis, which ended up being very helpful for conceiving William, my almost 5-year-old now. And while I strongly feel that my functional medicine knowledge greatly helped, things like eating anti-inflammatory, taking supplements to support egg quality, detoxing my body, avoiding endocrine disrupting chemicals, all that jazz, I also needed conventional medicine both times to conceive. And so my listeners have already heard some of my story again, which is going to be fully shared in my next book. But today I want you to share your focus, which again, I utilized, which really is this fertility awareness method and your passion for helping women conceive, because a lot of women have no idea what that kind of charting, right, and this method really are. So maybe let's start with why, when you opened your clinic, and then we'll move on to what the fertility awareness methods and kind of cycle charting are.
Yeah, great. So when we first started Radiant Clinic, it was actually this past summer. So I started seeing clients August of 2023. But prior to that, in my regular family medicine practice, I did offer these services as far as fertility awareness charting and all of that. So it's always been a part of what I did with my regular family medicine practice. But really within the past year or so, it became more clear to me that this is really where my passion was, that if I could do this all day, every day, that would be amazing. And so that's where Radiant Clinic was founded, was from really this passion to serve others in our community in this way, to provide education. Yeah. And really, there's not a lot of other clinics, quite honestly, even in the state of Iowa, that do just what I do as far as fertility awareness charting. And I think you teed it up perfectly, is that yes, there's definitely importance of integrative medicine and functional medicine, but there's really some times where we need more of that conventional medical approach in addition. And so, you know, certainly we always offer more of the integrative things, but sometimes it's like we need to go a step further. And that's really where Radiant Clinic can help to meet that need, is for people that are really still struggling to get to their goals, whether that's to achieve a pregnancy or to really achieve normal menstrual cycles or deal with menstrual cycle symptoms. So now this is my full jam all the time, every day, and I am loving it.
Well, congrats. You created your dream job. That's great. I was going to kind of ask what your ideal clients were, but you literally just listed kind of what those were, and we can circle back around to that. So let's move on to what this fertility awareness method, I don't know if I'm even saying it right. This is what I use, but I don't even know what it's called. Fertility awareness method or cycle charting. It kind of explain what those are.
Yeah. So there are actually quite a few different methods out there for charting your cycles. And really the big thing that we like to call out that's a difference with fertility awareness method is that most of them will require you to work with somebody who is an educator in these methods.
Sure.
Practitioners, educators, sometimes they have a medical background, sometimes they're lay. And so it depends on which method that you're utilizing. But the big difference is that you're taking actual biomarkers that's going on in your body day to day. Many of them will rely on observations of your cervical mucus or your cervical fluid. Some of them, that's checking your temperature, that's utilizing LH strips, whether it's checking for other, symptoms that you maybe have. But really looking at is from day to day, what is my fertility pattern showing? But most importantly, what is my ovulation pattern showing? So even if you're not trying to get pregnant, it's incredibly important to know, am I ovulating? When am I ovulating? So as to determine when is the to check lab work, when is the best time to implement treatment course. And so really it's important to have those pieces. Now I call that out because it's a little different than some of the different apps that are out there where you just plug in the date of your period and then it makes a days of your last cycle when you'll be ovulating or when you'll be fertile. And so for some people, those work great, but it really only works for people that have very normal cycles, that everything's 100% normal. I have very few women come to me with a 100% normal cycle. And so really just being able to know what's happening with your cycle day to day, that's really what makes a fertility awareness method different. Is that it has that variability no matter where you're at in your cycles. If you're just in your cycles as a young teenager, if you're approaching that perimenopause or menopausal transition, if you're breastfeeding, if you're postpartum, if you're just coming off of the pill, these fertility awareness methods can be used for any of those circumstances to really get a better what's going on with your body.
Perfect. So can you expand a little bit on like the charting, like what women are charting? Because again, I think this is very different from even when I started doing it, from looking at the app, because the app usually isn't asking for things like cervical mucus or like the color of your bleeding. You're just plugging in dates. So like what makes this different? Like what specifically are women charting like every single day?
Yeah. So for most of the methods that we teach here through our clinic, the big difference is that they're going to be charting those cervical mucus observations. So the reality of what this looks like in real life is I go to the bathroom before I pee, I take a clean sheet of tissue paper, I wipe and I check and see, is there anything on the tissue paper? I pee, I wipe again, and I check again, because you're really looking just for that a cervical mucus that's observed. Now, depending upon the different method that you're using, you will determine what's the stretch of that, what's the color of that, what does that look like, what's the amount of it. And all of those things are important biomarkers that we evaluate to determine where you're at in your cycle, but also, is there anything abnormal? The same applies for even if you don't observe any cervical mucus. For example, if we're looking at bleeding patterns, it's not enough for me to just know, oh, I bled for 5 days. I want to know how much, how heavy was it? Was there anything unusual to it? Was it brown bleeding versus red bleeding? Because again, all of those pieces can play a role into determining other underlying health conditions that may be going on.
I think cervical mucus is so important because I knew that it was important, but all of the doctors I saw, I went to, with William, I went to doctors in 3 different states. No one was asking about my cervical mucus, right? Which you have to have eggs and sperm, but guess what? They travel through the cervical mucus. So if you have none, right, they're not going to meet. And I think that's something that's very much overlooked, that it sounds like is an emphasis of this type of, charting, whatnot, observation.
Absolutely.
So what's the goal? What in a perfect world, again, nobody has perfect cycles, but what indicates fertile cervical mucus? What do women really want to look for? What do they want to have?
Yeah. So ideally what we're looking for is 2 different pieces. We want to first look at the time frame of when you're ovulating or when you're having that fertile mucus. So what we're going to be looking for is, if you're somebody who has cycles that are approximately 28 to 30 days, is that you're going to be having fertile mucus approximately 2 weeks before your period starts. So that time frame is called the luteal phase. So after you've ovulated until the time of your next period is luteal phase. And so oftentimes we'll see women that'll come in and they may have a luteal phase that's really short, and that can make it really challenging to get pregnant or to stay pregnant, because there's not enough time for that embryo to implant before your next period starts. So really looking at the timing of when that occurs. And then the second important part is the actual quality of that mucus. So for most women, a normal cycle is having anywhere between 5 to 7 days of mucus in your cycle that we consider fertile mucus. So in general, that's going to be mucus that is stretchy, that it stretches more than an inch, that it has some clear color to it, and that it feels slippery when you go to wipe. So those are kind of the big things we're looking at. And there have been a number of times when we work with individuals who, the timing might look good, but they just don't have that quantity or quality of mucus. And all that we have to do is to adjust how much mucus they're seeing. And they get pregnant without any other interventions of hormones. And so it really is important to have those two pieces, the quality, consistency of mucus, as well as the timing.
That's great. I want to stay on this topic here because there are many medications that can dry patients out and get rid of that mucus. Like right now, we were both talking about colds are going around. I have a little bit of congestion, so patients might take medications, right? Antihistamines, whatnot, to dry them out. Well, guess what? That can right?
Yep.
So again, doctors aren't always looking at these things. And then on the flip side, there are things you can do to improve your cervical mucus, right?
Yeah.
So N-acetylcysteine, I heavily use supplements with my patients. Sometimes that's not enough. Mucinex, right? There are over-the-counter medications that can help patients achieve that. Because, sometimes when I even talk to my patients and they're like, I need 5 days of this cervical mucus. I only have one,
Yes.
Sometimes it sounds daunting to achieve, but you really do you describe that very well, that kind of egg white, stretchy, like consistency that's clear, right? That's going to help, again, carry the sperm to where it needs to go. So great. Wonderful.
The other one that I would just say real quick is a common one is vitamin C. Will also dry up mucus quite a bit. So we all talk about, especially this time of year in the winter, when vitamin C is good to help with immune function and all that, but it does dry up cervical mucus as well. So in people who are really insistent on taking it, sometimes I'll say, okay, let's just avoid it during that time. When we would normally suspect that. So that's just a really common one, in addition to, like you said, antihistamines is the number one offender that I see. People come in on a daily antihistamine and we stop that. And it's like, oh, hey, there's my cervical mucus. It came back.
It's back. Yeah.
Yeah.
So how in general can charting our cycles improve our health, even if we're not trying to achieve fertility, like a pregnancy?
Yeah. So, there's a lot of different pieces that we look at beyond just fertility. So I talk about this, especially in a lot of the young teens that I work with, or in women who are maybe in their later 40s trying to avoid pregnancies. But, even throughout, if you're not trying to get pregnant, couple big things that we look at is that if your cycles aren't occurring regularly. So for example, if they're happening too close together, I'm having a period or I'm having bleeding every 2 to 3 weeks, certainly that can set you up for anemia or blood loss, which can be not great for your body or system. It can cause lots of other troubles. The other thing is that one of the most common things that we see that causes irregular cycles is actually thyroid dysfunction. And I know your listeners are very in tune with paying attention to what's going on with their thyroid, but really thyroid can affect just about every single cell and system in your whole entire body. So really using that menstrual cycle and what you're charting as kind of a vital sign for like, hey, what else might be going on in my cycle? And then the other side of things, rather than cycles being too short or too close together, is if we see cycles are starting to space out. So that you're now, 5, 6, 7 weeks between periods, or sometimes more. I have women come to me with 2 or 3 months between their periods. If you're not cycling regularly enough, that typically will indicate some other hormone dysfunction going on, whether that's an ovulatory dysfunction, whether that's too much estrogen in your system, not enough testosterone in your system. All of those things can kind of clue us into something else that may be going on that can extend well beyond just fertility, affecting your bone health, affecting your mood, your brain health, all of these other things that are so important to who we are.
Wonderful. Okay, so why does traditional medicine recommend birth control pills for most menstrual cycle irregularities? And I could go off on a big tangent here, but I'll let you answer that.
This is one of my favorite questions I get asked is I get a client that comes to me and they'll say, well, why did my doctor put me on birth control if it's so bad for me? And I think it's one of those things I always tell people, you only know what you know, right? So in medical school, the amount of education I got specifically on fertility awareness methods was for no like one line and one slide of an entire thing in my whole, thousands of millions of slides throughout medical school. So honestly, that's probably, unfortunately, the biggest answer is that there's just not education about these fertility awareness methods. The other thing is that we are taught through medical school, through residency, that if there's any menstrual cycle irregularity, just put them on the pill and it'll fix everything. And, certainly I have
Which is not true. That doesn't fix anything.
Exactly. It covers up symptoms. It makes problems worse. Absolutely. And, my biggest thing that I always tell people is like, if you are a teenage female who comes in on birth control, Your doctor likely will say, oh, you're on this because of acne, because of migraines, whatever.
Heavy
But
periods, whatever.
if
Yeah.
you're a teenage male who comes into my office with acne, I'm not going to start you on birth control. So why would we do that for females, right? Like there's just no good reason to do that. And so for that reason, I have actually never prescribed birth control for any reason in my clinic, because I know that it is just masking the symptoms of something else that's going on. There are always ways that we can treat other problems. And interestingly enough, if you look at the FDA regulated indications for birth control, the only two that are FDA approved are for acne and for contraception. That's it. There is certainly lots of other reasons that we see that it's prescribed, but again, you're always just creating more problems down the road. You're covering up some underlying issue that needs correction. And especially if you're a teenager who gets put on birth control, at some point in time, you might want to get pregnant. So we want to fix that problem before you get to that point of now
To
you've been on birth
optimize your
control.
fertility. Exactly.
Yes.
Yeah. Not
Yes. So
delay. Yeah.
rather than being on birth control for 15 years and then trying to come off of it and get pregnant, it can be really hard for some people.
Yep. Sadly.
Yeah.
I have to, it's hard for me to not, institute my opinion on some of these questions, because I would also answer that I think conventional medicine many times simply has no other solution. Like you said,
Yes.
they only know what they know.
Yes.
So it's either birth control, antidepressants. Okay, maybe they might give acne medication, whatnot. But the sad part is, although these medications are band-aids and you may feel better, your cycles may regulate, your bleeding may reduce, right? In the short term, maybe not.
Yep.
Being on medications can cause nutritional deficiencies, which can
Yes.
worsen the symptoms. So it's a vicious cycle. And
Yes.
we talk a lot about this. I had Dr. CJ Clean and Dr. Hannah Anderson, both local chiropractors, but who support both of our practices and send us patients, and vice versa, on episodes 134 and 135, I believe, where those episodes were just called Girl Talk. And we talked a lot about just informed consent when birth control is initiated, because I think that's so lacking. And so many women are just put on birth control, and then they're suffering consequences years down the road, sadly, because they were never really explained the whole, situation. So I'm with you. And I think, wow, I don't know that there is another doctor out there locally that can say what you said, meaning like, I just don't prescribe birth control. Like I try to, figure it out. So I think that's great.
Yeah.
So why is it so important that patients have regular menstrual cycles, and maybe define what a regular cycle is? Again, even if they're not trying to get pregnant. You kind of already answered this a little bit.
Yeah, that's okay. Let me give some actual numbers though. So typically we look at a regular menstrual cycle as I'm having a period that lasts anywhere between 28 to 35 days between each cycle. Bleeding, typically we say no more than 5 to 7 days per cycle. And we should see some sort of ovulation window. So some type of that fertile mucus, generally somewhere around 2 weeks beforehand with that mucus cycle, somewhere 5 to 7 days. Now, with that being said, there are certainly variations of normal. One thing that we always learn in medicine is people's bodies don't always read the textbook as far as what normal is. So there may be a different normal for you, but really if we're looking to optimize, I rarely see somebody who falls outside of those numbers that doesn't have something else going on from a hormone standpoint or thyroid or endocrine function, that there's something else going on. So that's kind of what we're looking at. And again, we're looking at kind of that longer term picture, right? Bone health, brain health, nutritional deficiencies, all of those other pieces that can play a role if we're not falling within those normal numbers.
Just like how you said, this is a vital sign. I mean, it's literally a sign of vitality, just like having a good libido is a sign of vitality. Those who have that libido tend to live longer, right? I've seen women in their 30s who have come to me not cycling, whose primary cares haven't really cared, who ended up with fractures, and then I ran a DEXA and they had osteoporosis, right? And so we're finding big, huge problems that should have been addressed years prior. And, it is what it is. We can only move forward. We can't move back. But, if you're not having a menstrual cycle, that's an extreme example. But you've alluded to kind of bone loss. And yes, it literally happens. And it's kind of shocking when it does, but it can. Okay, I want to spend some time on the next question. So how does charting cycles help with infertility evaluation and diagnosis? Because I also want to get into labs as part of kind of this answer too. Like that's something with me as far as, when my charting didn't look perfect, it was important that we checked hormone levels and whatnot, and tried to optimize them through various methods, HCG and progesterone and whatnot. So let me rephrase that question. So how does charting cycles help with an infertility evaluation and diagnosis?
Yeah. So the most important piece is that it helps to speak the same language, right? So it's really challenging if somebody comes in and they're like, yeah, I'm having a period roughly every 20 days. I think I'm ovulating, but I'm not sure. Like, so to see those actual numbers, it helps me immediately to just look at a chart and go, okay, cool. I know that this part is normal, this part is abnormal. Therefore, I need to look at these pieces of it. So really just kind of helps to cut through some of that. And it's really hard. Like if you ask women who are not charting, when was your last period? They have no idea. They're like, I mean, I think I had it this last month. I don't know exactly, right? But women who are charting every day, they can literally pull out their chart. It's just that easy reminder. This is when it was. Oh, and by the way, this is when I ovulated, and this is when all of those pieces are all right in front of you. So really just kind of helping from a memory standpoint. The other piece though is that when we're looking at evaluation for infertility from a lab standpoint, it's so important to know when exactly did you ovulate. And by using these fertility awareness methods, you're able to see basically to the day when I've ovulated, right? And so that helps, it makes a huge difference because, for example, one of the hormones we look at a lot is progesterone. So progesterone prior to ovulation is near zero in your system. If we check and you've ovulated, we should check a progesterone level after you've ovulated. That's when it should start to increase. We know that approximately 1 week after you've ovulated is when progesterone should be at its peak. So if I can test you on those particular days and know where your levels should be, it makes a huge difference in being able to evaluate that. Versus if you're somebody who is having cycles who are a little bit irregular, kind of the traditional way that we're taught in medicine is to check a day 21 lab. Now, that assumes you're having a normal 30-day cycle. That assumes that you've ovulated on day 14. And what we find is that even in normal cycles, the day that you ovulate, it can swing vastly from month to month, depending on lots of different things. So really being able to time those lab draws specifically to ovulation is so important in that infertility evaluation and helps give us a good idea of a lot of other things. So we're checking all sorts of stuff during that time, but really being able to have that charting helps give us a better idea of when you've ovulated because it makes all the difference in the world as to know, is that normal or not at that time?
I want to go back to charting too, because it's kind of hard to explain. I guess, this will be posted on YouTube and I could have brought a chart to like show, but essentially with charting, and I am a very much a paper person, so I actually don't mind this. But with charting, you're literally putting a sticker on the chart every single day, right? For if I'm bleeding, and then you're charting what do you call it? The color of the blood and how heavy it is, right?
Yes.
So when the patient's bringing you in this chart, you're literally looking at how many days did they bleed? Again, like the I don't know if I'd call it quality, but whatever, the heaviness of the blood and the color.
Yep.
And then they're charting the cervical mucus. Like you said, they're checking every day for the mucus. So you're seeing how many days, because they're putting stickers on this chart to show the mucus, and they're charting the quality of that mucus, like how stretchy it is, right?
Yeah.
And they're even charting later then, if they're having bleeding preceding their normal cycle, having breakthrough, spotting, whatnot. So you're seeing over the course of the month, how many days, right? And you're analyzing all of that.
Yes.
So that's, maybe you can describe that better, but as a patient who has done it, that's just how I would describe it, I guess.
Yeah, absolutely. And I think that's part of it is that you kind of get that big picture. And so what we can see then is like, what did your cycle look like this month? But then I'm also able to see, okay, over the past however long, I compare the last 5 or 6 months, how many times is this happening? Is this a recurrent, pattern that we're seeing? And if so, what do we need to do to evaluate that particular thing a little further? For sure.
And that's where I want to go. So like with me evaluating further was testing hormone levels. And I have my own way of doing things, in my practice, but I can't just like treat myself for everything. I also understand it's wise to seek, outside counsel. And so at least through, and I don't know if I'm saying this right, but were you like certified or trained through the Pope Paul Institute, or is that, what's your connection? Okay.
Yep. So they have a training program for medical professionals who can go through and become a certified medical consultant. So they learn all of their protocols. And then depending upon what you do, so for example, I'm not a surgeon. So at some point in time, if my patients require surgery, we send them on to a specialist who does surgery. But basically everything up until surgery, I have the same level of training that they've done as far as the hormone evaluation, the diagnostic process, treatment protocols, all of that.
Perfect. And I think that's what happened with me. Honestly, it's so long ago, it's hard to remember, but like started with you, right? Tried me on some progesterone and whatnot. And it really just got to the point where I was trying to avoid having a laparoscopy, but it was just needed. So I guess that's a question I could ask. How do you determine when it's time for a patient to seek that surgical, counsel?
Yeah.
Yeah.
So there's kind of two different times. The first is that if we're going through the screening process when I initially see a patient, and if they're exhibiting signs or symptoms that lead me to think, hey, there might be some endometriosis, some scar
Yep.
tissue, something like that, I typically will say, hey, let's start this process to go see the surgeon, even just for a consultation. So for a lot of women, what that's going to look like is I have severe cramping and pain with my cycles. I have severe pain at certain times of my cycle. So for example, when you ovulate and when you have your menstrual cycle. A lot of times, if we'll see that people have significant GI disturbances during the time of their period. So I know that I always have 3 days of diarrhea before my period, something like that, because we
Sure.
know endometriosis tissue can implant on the intestinal walls as well.
Yep.
So if there's that, or if I've got somebody who has a history of lots of scar tissue, so has had lots of other abdominal surgeries, other scarring, whether that's from past infections in the pelvis, some of those things, that generally will say, hey, let's start with the surgery process and at least get that consultant involved early on. In the meantime, we're always working on evaluating the hormones, looking at the labs, looking at the charting. And if I get to a point of we say, okay, we've optimized hormone levels, we've got you on the appropriate treatment protocols, your charting looks normal, your numbers are all falling within normal range from your dates to your hormone levels, and we have been trying to achieve pregnancy for a time frame, usually we say somewhere around 3 to 4 months without success after everything's been optimized. Oftentimes that's where we'll get a surgeon involved, because what we find is that more than half of the cases that we send for laparoscopy, we find endometriosis as the cause of that infertility. And there are a
Wow.
lot of
Yep.
women who have endometriosis that have no symptoms of it. But
Yep. Thank you for
endometriosis
saying that.
causes,
Yeah.
yes,
Yep.
endometriosis causes significant inflammation. Some women have no symptoms of it, but that inflammation can be enough that it impairs implantation. It can impair the ability of that fertilized egg to travel down the fallopian tubes if that's
Yeah.
inflamed. And so correcting that underlying cause of inflammation can make all the difference for some women.
I mean, it could be anywhere in that,
Yes.
pelvic cavity for sure. So thank
Yes.
you for saying, because I was going to ask, time frame standpoint, when do you refer, like after things are optimized? And you basically said 3 to 4 cycles, after
Yes.
things are optimized. If you're not achieving success, then yes, next step is to seek, surgical evaluation.
Yeah.
You also alluded to what you're saying after hormones are optimized. So let's go back to what are your tricks and tools for optimizing hormones. So if the charting is looking like someone needs progesterone, kind of when are you again checking labs and how are you replacing progesterone? Let's
Yeah.
go there.
Yeah. So there's a lot of different things we look at from a standpoint of the lab evaluation. Like we had mentioned before, most of the labs that we check are going to be after you've ovulated, because that's specifically when progesterone is elevating. And so then it makes sense that therefore, if we're going to provide you with progesterone, we're going to give it to you only during that time after you've ovulated. And so again, another
When it's
important reason
supposed to
to
be
chart
high. Yes.
exactly. So another important reason to continue with that charting or tracking of your cycle, okay, I've ovulated, therefore this is when I start the progesterone. So that's just an example with progesterone. A couple things that are really important about any of the hormones that we prescribe. First of all, we only want to prescribe bioidentical hormones. So that's going to be hormones that are matching what is produced in your body naturally. If you look at the general FDA approved medications that have progesterone in them, there's a billion of them, but there's only a small handful that are really that micronized progesterone, which is the bioidentical form. So it's really important to know what type of progesterone you're getting prescribed, making sure that it's bioidentical so that A, it's not working as a contraceptive and causing more troubles, but B, that we're minimizing side effects because we're giving you something that's the same as what's going on in your body. And that's going to also apply for any of the other hormones we talk about. The other time that we generally will check labs is that I often will check labs early on in your cycle. So if you start your period, and we call that day 1, somewhere between day 3 to 5 of your cycle, we generally will check some other hormone levels. And really at that time, I'm looking to see what's going on with your ovulation function. Does it look like your body's getting prepared to get an egg ready to go for that cycle? Are you having other troubles from a hormone standpoint in regards to androgen levels? So your testosterone, your DHEA, androstenedione, looking at those other pieces. The other one that we've started doing a lot more recently has been looking at your blood sugar and insulin levels. We find a huge link to glucose intolerance or blood sugars being too high And that can cause significant problems with impairing ovulation function. So looking at those pieces, and then as we had mentioned, a full thyroid panel, adrenal health, so cortisol levels, some of those other pieces. So we're really getting just an overall good view of what's going on with hormones, because the one thing we know about hormones is that they change every single day and that they all impact each other. And so it's not enough for me to just say, yeah, your progesterone is low. I want to know why. Is there something else going on earlier in your cycle that's causing it to be low? Is there something in your lifestyle habits that's causing it to be funky? Or is it just, hey, it's abnormal because you're struggling to ovulate on a regular basis? So really kind of digging deeper to look at all of those pieces, but then also knowing when is it appropriate to start with some of those supplements versus, hey, can I try and change something with my diet, with my exercise level? Are those pieces that need some work? And we can kind of layer those depending upon where people want to go with that.
Gosh, I want to ask so many questions based on what you just said, or comment on what you said. So thank you for differentiating the difference between synthetic progestins, right? So if you're taking something at home that says medroxyprogesterone acetate or levonorgestrel or a progestogen, those are not progesterone. If it doesn't say progesterone, it's not progesterone. It's some synthetic alternative, which is likely a contraceptive, like you're saying. Many patients also, at least my patients who have not tolerated birth control, when I want to put them on natural progesterone, many times they're leery because they say, oh, I didn't tolerate that. I gained weight. I had headaches, whatnot. This is the same with men, even men who've taken synthetic testosterone, who we put on, more bioidentical versions. But I will say 95% of the time, even if patients didn't tolerate the synthetic version of the hormone, they do tolerate the natural bioidentical, right? And that should fit like a key fitting in a keyhole. It should fit into their hormone receptor, cause fewer side effects, and cause good things to happen. Your body recognizes that hormone. So yeah, I just want to comment on that. What do you do? So we kind of talked about heavy bleeding and how that can, and painful cycles and how that can suggest endometriosis. What about the flip side of that? So what about if someone has very light bleeding, they're not bleeding much at all? And even if let's go there actually, and then I'll ask the next question. So what does that tell you? What do we do about that?
Yeah. So most often what we find is that if people are having really light cycles or just infrequent or scanty bleeding along with that, oftentimes we find an estrogen deficiency. So estrogen levels are too low because estrogen is really the hormone that's responsible for helping to thicken that wall of your uterus. And then if you're not pregnant, then you shed all of that lining when you have your menstrual cycle. So if estrogen is not present in good enough quantities, then oftentimes we'll see that that can be the problem. So there's a lot of different lifestyle things we see with this. Stress is probably number one thing that we find that causes estrogen levels to be too low, but certainly we find other things. So estrogen and testosterone have a really good feedback. And so if testosterone levels are too low, estrogen levels can be too low. If your progesterone levels aren't firing appropriately, the estrogen doesn't have anything to fight it off either. So, really there's typically some other underlying cause that's causing that estrogen level to be so low. So that's probably the most common. The other would be thyroid. I think estrogen deficiency and thyroid are probably number 1 and 2 for those scanty cycles. And again, as we had mentioned, thyroid can cause any sorts of craziness. I always just think of it as this like crazy little elf that's running around and wreaking havoc throughout your whole system, because thyroid can really mimic any of these hormone deficiencies.
We talk a lot about on the podcast about estrogen dominance and how bad it can be and how it can lead to, heavy bleeding and whatnot. But on the flip side, you don't want to be estrogen deficient either, right? You have to have a thick enough lining for an embryo to implant in. Like you have to. So you do need estrogen. You do actually need to have a period. So yes, thank you for saying that. So what do you use DHEA? Oh, actually, sorry, my brain, it just goes too fast, too many different directions. I also want to comment on you saying stress can cause low estrogen. So I say this all the time, stress is your body's biggest hormone hijacker. Not that it can just rob you of estrogen, but progesterone as well. And many of my patients who are younger overexercise. And so that's a big one where we literally have to say, and sometimes it's their parents who are bringing them in saying, my daughter's not cycling. I think she's overexercising. Help me encourage her to back off so she can get her cycles back. And honestly, many times that's the case. It's not that you can't exercise. We want you to exercise, but you also need to make sure your nutritional intake supports that, right? That there has to be a good balance there too. So when you say stress, just so the listeners are kind of thinking, well, what does she mean by stress? Stress can be biological, physical stress from exercise, psychological. There're just a lot of different types of stress that can impact your ability to make hormones. So do you use DHEA to
I,
help
d-
with estrogen
I
and
do.
testosterone
Yeah,
time to
we
time
do.
in the younger women? Yeah.
Yeah, and it kind of depends. Again, we're looking at DHEA levels. That's one of the specific things we draw, but then we also look at those things that happen downstream of DHEA. So for people that may not remember, DHEA is kind of a precursor to lots of the other hormones. So DHEA converts to androstenedione, and then androstenedione goes on to become testosterone and estrogen in the form of estrone specifically. And so oftentimes we'll see is that if that DHEA level is low, the other ones can be low as well. So
Everything downstream.
yes,
Yep. It's going to be,
exactly.
yep.
So yes, we utilize DHEA. Again, very dose dependent, very much a standpoint of we're monitoring your other levels as well, because again, we don't want to go too high on it. So DHEA is one of those I always caution people on is that yes, it's a great supplement, but it is not one you should take without having, consultation with a medical professional who understands all of the pieces to be checking with that. Just because it's over the counter doesn't mean it's safe to take long term. I've had actually really recently, within the last couple of months, somebody that came in, she had her lab work done from a different provider. She was living out of state, found out everything was low, started taking DHEA, and then didn't follow up with that person at all. We rechecked her levels and now they're way too high. And she's having significant symptoms,
Side
too much
effects. Yeah.
testosterone, too much
Yeah.
estrogen, heavy bleeding, facial hair growth, all of the things. So it's one of those, just because it's over the counter, it is not benign. It can be very active in some people, but yes, we use DHEA in those cases where it makes sense. And we see, hey, kind of everything is suppressed downstream for sure.
Sure. And then what if upon reviewing someone's cycle, you see they're not ovulating? What are some tips and tricks to help those patients?
Yeah. So usually there's some other underlying cause. So I always tell people I like to play detective and figure out what else is going on, right? Whether that's PCOS or
Mhm.
polycystic ovary syndrome is probably one of the
Yep.
most common things we see or common reasons for not ovulating. So usually in those cases, we're trying to correct the underlying cause. So we're trying to bring the androgen levels down. We're trying to help stabilize blood sugar levels. And oftentimes that will do it. If we can get the blood sugar levels back to normal, if we can get the androgen levels back to normal, oftentimes people will ovulate on their own. Now, what usually happens, that's best case scenario, is people know that, we recognize that early. But what usually happens is people come to me and they've been trying to get pregnant for 4 years. They wanted to be pregnant yesterday. And so oftentimes we'll say, yes, we're going to still work on these lifestyle changes, but we're also going to say, are there other things that we can do to help with that? So we utilize a lot of myo-inositol. So it's a great supplement that helps with ovulation function. We do sometimes utilize some of the different ovulation prescription medications like letrozole or Clomid, just kind of depending upon the actual cause. But again, we're trying to track it all the way back to say what's initially causing
Why? Yeah.
ovulation exactly.
Yep.
Fix that problem, because then we don't need to be on meds long term. We can, fix those other problems as well.
Wonderful. I have a excellent podcast with Felice Gersh, who spoke in my
Yes.
fellowship program on PCOS. That she's written the book. Well, she has another book out now, but PCOS SOS, very thorough. The podcast is almost over the head of some of my listeners. It's a two-part series. It's excellent, but I'll also post that in the show notes.
Awesome.
So you've mentioned we need, estrogen. We need to have a thick enough lining. We need to have healthy cervical mucus. We need to have ideally regular bleeding, right? And we need to ovulate, all these things. I want to allude to some brown bleeding that I personally had, because that's something that I think a lot of patients are not aware of is not a good thing.
Right.
So I'll share a little bit of my journey here recently. So this is with second baby, currently still inside, right in the womb here. So hopefully this isn't too much information, but for the past several years, I've had what I would call, or we would call, tail end brown bleeding. So a little bit of brown bleeding kind of at the end of my cycle, right? So I have nice, whatever you want to call it, healthy, bright red bleeding. And then that would at the end kind of turn into some brown bleeding, just a small amount. And honestly, all the doctors I've seen over the past several years say, oh, it's old oxidized blood. It's no big deal, right? They could honestly care less about it. And for some people, it may not be a big problem, but knowing that, I was pushing 40 and I feel like sometimes I just have known too much. I knew that that's a cue or a clue, just like everything else you've been saying, right, with the menstrual cycle. I knew that that was not okay, especially because we were not able to conceive. I knew my eggs were fine. My husband's sperm, were fine. So there was something impairing our ability to get pregnant. And part of what my listeners may know is I had chorioamnionitis with my son, William. So again, about 5 years ago. So I had this major infection of the pelvis, which I took IV antibiotics around the clock for in the hospital for a week. I had postpartum hemorrhage. I had blood transfusions. It was a scary time. And in the moment, I was just trying to survive, right? But then weeks and months later, I'm thinking, oh my gosh, I had this infection. Is that going to impair future fertility? Right.
Mm.
Well, then the thought kind of leaves your mind because again, you're trying to breastfeed your kid,
Yep.
work and get back
Life
to adjust
happens.
to life. And then as we were not able to conceive, I asked many doctors, I said, well, I had this chorioamnionitis. Could there be some residual scar tissue in there? Could there be, a problem with impairing implantation? And they all said, oh no, you should be fine. We have lots of patients with chorioamnionitis who get pregnant. Well, I wasn't getting pregnant. So I had them do a blind biopsy. So where they literally went in, scraped the tissue, did it through hysteroscopy. They didn't find anything. And so I initially thought, okay, maybe I can check this off my list. I probably don't have, residual inflammation, an underlying infection there. Well, another year went by, we couldn't get pregnant. And so finally, summer of 2023, I said, somebody is opening me up. We're going in here to figure out if for years, this past infection, has had some sort of residual effect. And sure enough, with the biopsies they did that weren't blind, they could literally see the upper tip of my uterus, right, was all inflamed. I had endometritis, likely some residual, right, that just didn't get treated. I otherwise had no symptoms. I've never had an STD, right, which can cause endometritis. I've never had any other risk factors per se. But knowing what I knew, that brown bleeding, which we call tail end brown bleeding, was suggestive that something was not right. So lo and behold, I take antibiotics. I took lots of antibiotics. I said, just give them all to me, which normally I wouldn't want. But in this case scenario, I knew, let's treat this underlying infection. The brown bleeding goes away and I get pregnant, right? And my story is a little more complicated than that. There were some other things. But my intuition from the time that I had William was that, oh, shoot, this chorioamnionitis may play a role with my future fertility. Yeah. And so I just wanted to share that story for any listeners who had chorioamnionitis who are still struggling, to get pregnant, or for those who are having some of this tail end brown bleeding. Yes. So that was my experience. But can you kind of allude to why this is, not a good thing? And I will also tell the listeners, you don't have to have surgery to figure this out, right? If you find a provider like Dr. Minjeur who sees the brown bleeding, she can treat you with antibiotics. I had a lot going on. I needed to just have a laparoscopy, see if there was, recurrent endometriosis. I mean, there were multiple reasons why I said, we're doing surgery. Open me up. I need to get pregnant this year. So I don't want to scare the listeners into brown bleeding means you have to have surgery. That's not what I'm saying. Right. But in my case, the surgery helped determine why I had the brown bleeding. Yes. So can you speak to brown bleeding and why that's not ideal?
Yeah. And typically kind of you said it perfectly as far as it causes that inflammation. And so we see something that's not normal. So any bleeding in your cycle that kind of falls outside of that normal pattern is always cause for like, oh, I wonder what that's there about. So that brown bleeding, again, as you had said, kind of happens after your normal menstrual cycle. So normally we should see just kind of things start heavy and then it kind of slows down from there and then it stops. This prolonged brown bleeding where it can happen 2 to 3 days, sometimes more, we see that oftentimes it's caused from inflammation. Now, whether that's inflammation secondary to infection, secondary to scar tissue, secondary to another reason, we know it shouldn't be there. Sure. And so again, oftentimes what we'll do is we'll say, we'll look at that and we'll say, hey, let's just try some antibiotics. And usually what happens is within a next cycle, it's gone. Then we know, okay, it was caused by infection. We're good, but we're also going to keep an eye out to make sure it doesn't come back. Right? The other piece that we oftentimes will see that people don't recognize as abnormal is that if you have some of that brown bleeding or spotting that happens before you have an actual flow of menses. So usually we're not talking like, okay, I had a little bit of spotting and then like an hour or two later, my actual flow started. I'm talking like 2 or 3 or 4 days of this spotting that leads up to the actual menstrual cycle starting. Now that can be something different. Most commonly we'll find a progesterone deficiency as the cause of that. But that can also be kind of something that indicates, especially if there's other tail end brown bleeding. So at the end of your menstrual cycle, that can also be an indicator of that infectious or inflammatory process that's going on. And so again, I don't do surgery, so I can only do the tools that I have in my bag. But there are lots of times we'll just look at that charting and there's nothing from a hormone standpoint that needs to be checked. It's just having the knowledge of that charting, what's normal, what's not. that we're able to then institute that treatment protocol and see, can we get this cleared up?
And this is just such good information for the listeners because again, typical OB-GYNs, which we need them, and I needed surgery, right? For
Yeah.
both times, for both
Yep.
both children, I needed conventional medicine, not poo-pooing them, but many times they jump to that intervention when obviously there are so many things before surgery, before IVF, before, right, that we can consider. We can
Right.
look at the cycles, look at the cervical mucus and the bleeding and the quality of that. And so that's literally what you do, right? In
Yes.
hopes to prevent women from having to have these more aggressive, expensive interventions.
Yes.
You alluded to earlier, there are some diet changes, kind of lifestyle changes that can also help. And I, again, could go off on my soapbox here, and I will, but I'm going to let you first share, in your opinion, kind of what changes can patients make?
Yeah. So probably the top ones, and you had already kind of touched on this, is that exercise, right? Is that we want everybody to exercise, but you can't have too much exercise. It's that happy medium. So in general, my rule is that if you are doing high intensity exercise, right? So like you're doing HIIT exercises or you're doing cardio kickboxing, something like that, where you're really getting your heart rate up. We like to aim for no more than 15 to 20 minutes, 3 times per week. Now, I lose a lot of friends when I say that because people that do really intense exercise are like, but I need to do more, right? But what we find is that anything beyond that can really start to impair your cortisol levels, which then affects everything else downstream. Alternatively, if you're somebody who's doing more moderate exercise, I'm doing walking, I'm doing gentle stretching, something like
Yoga.
that.
Yeah.
Go ahead, have at it. That's going to be great. We say a minimum 30 minutes per day, ideally 6 to 7 days per week, right? So getting that regular exercise is really important for your body, but also not overdoing it. When it comes to diet, I don't have a specific diet plan that I make people follow. And the reason is I don't want them to do something that's not going to be sustainable. So in general, we talk about getting rid of processed foods, watching your carbohydrate intake. So for a lot of people, they have that glucose intolerance issues, and that when you get carbs or starches in your body, they are whole grains, they are, fruits, vegetables, those things, rather than, having a package of Oreos for lunch. The other piece is just in general, lean proteins, fruits, veggies, whole grains, healthy fats, really, really important. I think a lot of women especially get really focused on trying to lose weight, and so they avoid fats altogether, but really saying, when I have my fats, I'm having those good healthy fats, olive oil, avocado, nuts, some of those pieces, because that's incredibly important, especially to cholesterol formation, which helps to regulate your estrogen function. So exercise, diet. The other piece that we love to talk about is sleep. I rarely have somebody who is consistently getting more than 7 to 8 hours of sleep per night. Sometimes they have young children at home. Sometimes they have a weird schedule. Sometimes they just like to stay up and watch TV really late. But really, that sleep is so important to making sure that we're optimizing and repairing and restoring what's going on with your natural cycles. And then stress reduction. This is probably the hardest one because there's not a way to just turn off that stress switch in our bodies, right? But finding ways, can I plan into my day a time that I know is my downtime, whether that's meditation, prayer, yoga, quiet, deep breathing exercises, whatever that looks like. But that stress reduction is so important to kind of have that reset in your day. So those are kind of the main ones that I talk about. I know it's easier said than done to optimize all of those, but again, those are just general good, healthy living tips that we all need to be striving for.
That was kind of part of my story, that again, my listeners have heard, but when I was trying to get pregnant before, I was doing CrossFit. I mean, I was way over exercising. My body was just so stressed. I had tachycardia. My heart was pounding out of my chest. I was in this sympathetic overdrive. It's like, no wonder my body was not wanting to get pregnant. Like I wasn't in that state. Yes, I needed to correct my endometriosis, but my body was like, whoa, you need to calm down. I got to the point where I couldn't even walk on a treadmill. My heart rate would elevate. So my body was telling me, do yoga, do deep breathing, literally slow down. Yeah. And it took me way too long to listen to the signals my body was sending me.
Well, it's basically your body's way of saying this is not a good time to get pregnant. You got way too much stress. We can't also carry a baby. Your body's real smart.
Right. The three things that I say all the time, and I have this just as a free tip sheet on the yourlongevityblueprint.com website, but literally what you said. So reducing stress. Again, I already said this. Stress is our body's biggest hormone hijacker, and there's no pill, potion, or powder that's going to change your lifestyle. It's going to replace lifestyle changes. So only you have the power to do that. And so again, yes, sometimes it's just, I've told my nursing patients, like, go sit in the bathroom for 5 minutes. If you have to get away on your shift, like, everybody needs mental downtime, right?
Yes.
Everybody, moms, nurses, everybody does. So you
Yes.
need to allow that time for, headspace, whatnot. So listen to a meditation app, do yoga, deep breathing, whatever it is for you, but that's very important.
Yeah.
Food sensitivities, in my opinion, are also stressors. And that was part of me healing from endometriosis. I went dairy free, and I was dairy free a year before I conceived William. Now, granted, I had surgeries for endometriosis, but I didn't want it to come back, right? So I had already been gluten free for years. I went dairy free. I got pregnant.
Sure.
And then flash forward to the last summer's laparoscopy I had. I basically had no endometriosis, which was amazing because 5 years had gone by and it hadn't,
Didn't grow
barely
back. Yep.
had one teeny little lesion, but I feel like that doesn't really count.
Yeah.
It just hadn't come back. So diet changes are important. And we do test patients for food sensitivities because getting the inflammatory foods out, for one person, that might be eggs, another may be sugar, the another might be grains, dairy, whatnot.
Yes.
We do test patients. So I kind of put that into the stress bucket because foods can even be a stress on the body. Another thing I talk a lot about is fixing nutritional deficiencies. And this is also really important. It's important in everyone, but also in my aging patients because egg quality decreases as you age. And what helps egg quality is antioxidants, right? Nutrients, whatnot. So that's also something that in functional medicine we can do. We can test patients for nutritional deficiencies. They're required to make hormones. They're required for you to detoxify. And even, I know this podcast is on fertility, but I've even had menopausal women with hot flashes with, a different degree of hormone imbalances who all we do is fix their nutritional deficiencies and their hot flashes go away, right? Yeah. So we just needed to get nutrients in them so that they could actually make some hormones. Yeah. So, if patients are drinking caffeine, if they're stressed, if they're not eating organic, they need to supplement. Everybody needs to supplement. Even my patients who grow their own organic food in their backyard, like, they need to supplement. We're all low on something. Yeah. And so back to, you were talking about, adrenals and thyroid and sex hormones, even neurotransmitters, right? We need nutrients to make all of those. So you really do need to be eating high quality foods and many times supplement. And we can even run a nutritional analysis to see if patients need CoQ10 or alpha lipoic acid or whatnot, and then supplement accordingly. And then thirdly, something that is still an ongoing journey for me, as is stress reduction and fixing nutritional deficiencies, is detoxing the body. So I really dove into this when I was trying to get pregnant. I got rid of all my, chlorine soaked tampons, went totally organic in that department and really worked to clean up my life. And so the three toxins that really can impact fertility that I briefly share with patients many times are plastic, fragrances, and dairy. So I already mentioned dairy, it's inflammatory. Just if you're trying to get pregnant, likely it's not good for you. So in my opinion, get that out. And then plastics are pretty much everywhere, right? Or sometimes your water bottle, ketchup bottle, baby bottles. I mean, plastic is everywhere. Plastics can have endocrine disrupting properties, as can fragrances. So even if it's not you, but it's someone else in your household that's using cologne or Axe body spray or whatnot, like, that can impact you and get into your laundry machine and onto your clothes. So I have several episodes donated to detoxing your home and your life, but those are just 3 tips, right? Dairy, plastics, and fragrances that can really impact your hormones that I do recommend patients just get rid of. So I did want to mention those from a lifestyle standpoint. And again, all those tips are on our website if you want that free download. So we've gone over a lot. Is there anything else that you didn't get to share yet? I mean, even case examples. Are there any case examples, that are popping up? I know I still come see you, and one of your staff members, when you first opened, she said, we've had, I don't know, 8 patients already get pregnant in our first couple months of being open, or, whatnot, which is so exciting. I mean, what a gift to those women. So do you want to share anything else or share any case examples?
Yeah, I would say there's so many times I think people come to me and they say, my hormones are a dumpster fire, like everything's a mess, everything's imbalanced. And oftentimes what we find out is that it's not as bad as what people think it is, right? So there are so many cases.
Hope.
Yes, exactly. There's so many cases. And thank you for sharing your story today. But, again, just so that listeners know, that's a very complicated story, right? Like there's a lot that went on there. There's a lot of different pieces that play a role, but that's not the story for everybody. Sometimes it truly is just a simple thing. I literally, one of those 8 patients that we talked about, all we had to do was get her off of her antihistamine medications
Yeah.
and she got pregnant the next month. Like sometimes it truly is
So
something
simple.
that simple.
Yeah.
Exactly. And sometimes it's as simple as saying, hey, you need to not exercise so much. Like I give you permission to stop training for a marathon that, you just started training for that happens in 2 weeks. Like that's not going to be okay. So there are oftentimes just some of those simple pieces, but really a lot of that just starts with that fertility awareness method charting. Just giving women and couples the power back to know this is when I'm fertile helps them then to say, okay, if we're trying to get pregnant, let's aim for that window of time, and their chances already go up significantly. What we find is in couples that have normal fertility, so no underlying problems, over the course of 6 months, approximately 90 to 95% will get pregnant on their own.
Wow.
And that's just with saying we're going to just have you
Yeah.
charting your cycles and understand when you are fertile, right? So really to take hope in knowing that, first of all, it can be fairly straightforward. There's sometimes it's just simple little tweaks we need to make and helping you to understand that. And then the other piece is in knowing that so far, knock on wood, I have not had anybody who we have not at least found an answer for, right? So when it comes specifically to fertility, certainly there have been couples that I have worked with that don't end up getting pregnant, but we have always at least found an answer, a reason, some other thing going on, whether that means I refer them on to another specialist or whether they
Right.
decide, you know what, we don't want to pursue XYZ. At least now we know, and we're going to go through adoption process or whatever.
Sure.
But I think that's the biggest thing is just helping people to find answers in spaces where oftentimes they're just disregarded, or they say, hey, we've been trying to get pregnant and we can't. And the doc's like, well, I don't know, good luck, like, see you later. Or like, I guess you must have to just go do IVF, even though you're not even having cycles. Like there's so many pieces where it's like, let's at least figure out if there's something else going on and getting things back on track.
Well said. Very encouraging. Okay, so if a listener wants to get started and work with you, where can they find you? Kind of how can they start charting? Tell us how that
Yeah.
works.
Yeah. Okay. So people that are interested in working with us are able to come see us for in-person appointments here in the Cedar Rapids, Iowa area, or we can do virtual visits. Our charting instructors can actually work with anybody from anywhere, basically in the world. As far as medical visits, because of my medical license, we are limited to clients within the state of Iowa for that right now. But we do have charting instructors in multiple different methods that can work through all of that with you. You can go to our website, radiantclinic.com, and you can actually book a free discovery call with me. And so if you are wondering, is this a right fit for me? Does this apply to my situation? I will talk with you through, hey, this is what this looks like. This is what you need for charting instruction, or this is what it would look like to work with us. And we can kind of go through what that process would be to make sure that it's a good fit for you before you decide, yep, I'm gonna jump all in with this. You can also check us out on Instagram. Our Instagram handle is Radiant Clinic _. And we also do have a Facebook page, Radiant Clinic, where you can follow us to learn more tips and tricks about how to balance your hormones. And then the final piece, we do have an event coming up here in Cedar Rapids at the end of this month. So it's Tuesday, February 27th at 6 p.m. It is at the Cedar Rapids Public Library. It is a free event. I will be speaking, and then we will have a bunch of our charting instructors and some of our other staff members there to answer questions, just to kind of get to know people, to really start providing more of this education in our community so that women know that there are options for them as far as further evaluation.
Wonderful, wonderful. Okay, last question. What's your top longevity tip?
Oh, so many of them. But I think probably the number one thing, if it comes down to it, would be sleep. Sleep really impacts so much, especially when it comes to our cortisol levels, but also kind of help with that restoring everything that went on during the day. And so aiming to get, ideally for adults, minimum of 7 hours, ideally if we can get 8 hours of sleep per night for adults, is so important to just helping long-term restore health, but also improve and keep that quality of life going longer term.
Very common answer. Sleep is important for literally
Yes.
everything. So I agree.
Yes.
Yeah. Well, thank you, Dr. Minjeur. Thank you for helping me, and thank you for coming on the show, literally sharing cycle wisdom. So I encourage the listeners check out your podcast and then share this valuable information with other women and couples in need. This is great new information to share. Thanks for coming on.
Awesome. Thanks so much for having me.